staphylococci is a gram-positive cocci which can cause serious skin and soft tissue infection. It is divided into many species, but medically important species are Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus. In this tutorial, we will study only about the Staphylococcus aureus, which is one of the most important bacteria in bacteriology. So, starting from the some important points about the Staphylococcus aureus, that it is spherical in shape and they are arranged in grape-like clusters and seen in microscope. Grape-like clusters. They are non-motile, they are non-spore forming, and biochemically they are coagulase positive and catalase positive. And this catalase is one of the important virulence factor of Staphylococcus aureus. Due to this catalase positive, Staphylococcus aureus can survive the killing effect of hydrogen peroxide and neutropil. Now, resistance to drugs, we will discuss this topic at the end. So now talking about some of the cell components and antigens of Staphylococcus aureus, they are protein A, lipoic acid, polysaccharide capsule, surface receptor, and peptidoglycan. It will be better that you take some page and copy and write all of this. You'll remember this. So purpose of protein A, what is its function? It binds to the Fc portion of immunoglobulin G and prevent the complement activation. So that there will be no C3b, a part of complement activation which help in opsonization. So there will be no opsonization, so it helps against the phagocytic activity. It is anti-phagocytic. It is anti-phagocytic. It is anti-phagocytic. Second is the trichoic acid, which mediate adherence to the mucosal wall, so that it helps in the infection. It also causes septic shock by releasing interleukin-1 and tissue necrotic factor from macrophages. Third one is the polysaccharide capsule. Its function is that it is purely immunogenic. So there will be no effective vaccine against Staphylococcus aureus. Some also has microcapsule. Number 4 is the surface receptor for the bacteriophage. So whenever there will be bacteriophage, it will bind to the surface receptor, enter the bacteria and help in the phage typing. Peptidoglycan has endotoxin-like properties. Now coming towards the transmission, it is mainly transmitted through the contact. It is found in the nose, skin, vagina, females and the fomites. Now those people which are at high risk are those which live in the highly contaminated environment containing Staphylococcus aureus, those having weak immune system, those having diabetes mellitus, and those using high doses and frequent use of IV drugs. Now coming towards some of the pathogenesis and clinical finding. So Staphylococcus aureus causes disease by two mechanisms, one by producing toxins and the second by inducing pyogenic inflammation. So first we will talk about the toxin mediated disease. They are food poisoning, toxic shock syndrome, and the scalded skin syndrome. Scalded skin syndrome. We will discuss all of these. First, we will discuss the enterotoxin. Enterotoxin, it is resistant, acid resistant, enzyme resistant, and has 6 immunogenic types from A to F. It causes food poisoning, characterized by vomiting and watery diarrhea. Mechanism of action is its superantigen releasing interleukin-1 and 2, which stimulate direct nervous system and cause vomiting and diarrhea. Vomiting being the more prominent. Second is the toxic shock syndrome toxin. It causes toxic shock syndrome, usually characterized by the fever, hypotension, a diffuse bipolar sunburn rash, and some organ involvement like kidney, liver, CNS. It usually occurs in the woman using tampon, in the patient with wound infections, and patient having nasal packings. Mechanism of action is the same, it is super antigen. Now, exfoliatin, it causes scarlet skin syndrome in children, characterized by fever, large vesicle, erythemus, rash, and skin scalding, having serious fluid exudates. Main is the electrolyte imbalance. It also causes loss of hair and nails. Recovery usually occurs in 7 to 10 days. And the mechanism of action is a protease epidermolytic, which cleaves hemoglobin in the desmosomes, leading to separation of epidermis and thus cellulitis. Fourth one is the alpha toxin, which causes necrosis in hemolysis. Mechanism is same. It forms holes in the cell membrane and acts as cytotoxin, which causes loss of low molecular weight substances from damaged cells and thus death. One is the leukocidin, which causes severe skin and soft tissue infection due to community-acquired methicillin resistant Staphylococcus aureus. It also causes necrotizing pneumonia. Mechanism is same. It form pore through toxin, especially in WBC. The main point is that the leukocidin, its gene is located like glycogenic page, so it will transfer its gene to page typing. The main enzymes are coagulase, fibronectin, hyaluronase, proteases, nucleases, and lipases. Now, how to remember all of these exotoxins or toxin? So the mnemonic is late. So L for leukocidin, A for alpha toxin, E for toxic shock syndrome toxin, and E for entero exfoliatin and enzymes. Now coming towards the diseases which are due to the inflammation, i.e. they are caused by multiplying in tissues causing inflammation and pus formation. So these diseases are skin and soft tissue infection, septicemia, endocarditis, post-surgical wound infection, pneumonia, conjunctivitis, osteomyelitis, and arthritis. Now we will discuss each one of these. So skin and soft tissue infection include abscesses, blepharitis, breast infection, conjunctivitis, serolitis, carbuncles, eye infection, folliculitis, etc. All of these, ardorium, impetigo, lymphangitis. So how to remember this? Start saying ABC. So A, B, C, A for abscesses, B for blepharitis, breast infection, C conjunctivitis, serolitis, carbuncles, and leave D. Leave D. Come to eye infection, F folliculitis, necrotizing fasciitis, leave G. H, I, ardolium, impetigo, and leave J and K. So come in alphabetical order, leaving D, G, J, and K, and you will remember all of this. The important point regarding this, that mostly this is due to the TV leukocidin, and usually they are community acquired. Second one is the septicemia, which are due to the wound infection and IV drug abuse. Third one is endocarditis, mainly occur in the prostatic heart wall, and that usually is right-sided endocarditis, which is a tricuspid wall, and it is usually occur in the IV drug abuser. Fourth one is the post-surgical wound infections. Fifth one is the pneumonia, which mainly occur in the post-operative patients and following viral respiratory infection of influenza. And this can lead to the emphysema and lung abscesses. Staphylococcus aureus is the most common cause of nosocomial pneumonia, especially in the ventilator-associated patient in ICU. Conjunctivitis, Staphylococcus aureus is the most common overall cause, but in children, Streptococcus pneumonia and Haemophilus influenza mostly cause this. 7 is the abscesses, is metastatic abscesses. 8 is the osteomyelitis and arthritis. So how to remember this? Remember the word SICO. SICO. S for skin and soft tissue infection, S for septicemia, E for endocarditis, A for arthritis, C for conjunctivitis, O for osteomyelitis. Now, Kawasaki disease. What is this disease? Nothing is known about its etiology, but due to resemblance to a toxic shock syndrome, we put them in the Staphylococcus aureus. So now, impetigo looks like this: erysipelas, serolitis, and folliculitis, synapses, necrotizing fasciitis, the hands of the toxic shock syndrome patient. Now we will come to the laboratory diagnosis. This occurs mainly through the microscopy, culture, and biochemical tests. Microscope, they look like gram-positive foci arranged in grape-like clusters. In culture, we use neutron agar and blood agar. In neutron agar, they produce golden yellow colonies, and this is due to the haploxanthin. A difference between the Staphylococcus aureus, epidermidis, and Staphlococcus. Watch videos which link is given in the description. Neutron agar. After neutron agar, we use blood agar, in which they form clear zones due to the beta hemolysis. The chemical tests include catalase, coagulase, and mannitol fermentation test. Both the test catalase and coagulase are positive for the aureus. Mannitol fermentation test is also positive for the aureus, but it is negative for the epidermidis and Staphylococcal. Now coming over the treatment, those species which are sensitive to penicillin are treated with penicillin. Those species which are resistant to penicillin are treated with methicillin, nepicillin, cephalosporin, vancomycin, amoxicillin. Those species which are resistant to methicillin, nepicillin, etc., they are treated with vancomycin and ceftaroline. Ceftaroline, remember, is only in the first beta lactam. Is the first beta lactam sensitive against MRSA? MRSA is resistant to all other beta lactam, and if Staphylococcus aureus is resistant to the vancomycin, like vancomycin intermediate resistance to Staphylococcus aureus, dermycin complete resistance to Staphylococcus aureus. So we use then daptomycin and quinopristine, dalfopristine. And the treatment of choice for the abscesses is incision and drainage. How these bacteria become resistant to the drugs like penicillin. So Staphylococcus aureus become resistant to penicillin by making changes in the beta-lactamase enzyme binding site. Some of the strains of Staphylococcus aureus become resistant to beta-lactamase resistance penicillin like methicillin and nepicillin, not by changing beta-lactamase enzyme, but by making changes in the penicillin binding protein, thus become resistant to it. And some strains which become resistant to vancomycin, like vancomycin resistance to Staphylococcus aureus, intermediate resistance to Staphylococcus aureus. So they do this by making changes in the gene that encode for D-lactate instead of D-alanine and peptidoglycan, which is the main site of action of vancomycin.